Hi, and welcome to the causes of disharmony according to the theory of traditional Chinese medicine. My name is James O'Sullivan. The 6 pathogenic factors. The 6 external causes of disease are causes of disharmony. They're also known as the 6 evils that relate to climatic conditions. Just as extremes of wind, cold, heat, dampness, dryness and summer heat can have devastating effects on the world in which we live, they can also seriously alter the balance within the body itself by diminishing or blocking the flow of qi within the organs. Let's take a look at wind. Wind, they say, brings in the 10,000 diseases. So in other words, wind is the carrier. So it's associated with spring, wood, and the organ that it's associated with is the liver. Wind is yang in nature. It tends to move from place to place. And when we look at the nature of it, it has a rapid onset. It comes and goes quickly. The symptoms come and go quickly. And it moves around the body. Meaning that it can move from place to place. In addition to tremors, we can also see wind as convulsions. May also be stiffness or paralysis. Twitching is also a sign of wind. It affects mostly the top part of the body, the head and sense organs, and it affects the lungs first. It can also affect the skin because it attacks the surface of the body and it can cause itching. And wind is most commonly affects us in springtime. When we look at internal wind, and we have 2 types of wind or 2 types of pathological wind, and the one is internal and the other one is external. So let's look at internal wind. First of all, well, before we look at the clinical manifestations, let's say that wind always affects the liver, and it's usually a chronic condition, and it is usually caused by a deficiency of liver and kidney yin or deficiency of liver blood. The main clinical manifestations of internal wind are tremors, quaking, spasm, dizziness. It sometimes also causes stiffness and paralysis, stroke. A stiff neck with the flu is a wind. Parkinson's post-stroke sequela would also be considered wind, as would seizures, such as epileptic seizures, shaking from anger. Some migraine would also be internal wind. This would be wind blowing in the head. And the tongue is shaking or stiff and may also be red in color as well, body color, and the pulse would be wiry. It's an excess pulse that we find, and of course if we have a red tongue we probably have a rapid pulse as well. The causes of liver wind: first of all, excess fire affects the liver, and fire creates wind. It enters the blood level. We can have a high fever. This can also cause wind. Diseases such as meningitis. Poisons, toxins, radiation can cause wind, as can drugs and alcohol. External wind always affects the lungs. Causes would be that the invasion of pathogens from the outside. And wind combines with other pathogenic factors. The main clinical manifestations are sneezing, cough, aversion to wind and cold, runny nose, occipital stiffness and an itchy throat. The tongue doesn't have any change because it's an external pathogenic factor, and the pulse, it's usually the quality of the pulse or the quality of wind and whatever it's carrying, the pathogen that it's carrying, floating pulse. Let's look at the wind combinations. Wind combinations, first of all, wind combined with cold, the main clinical manifestations: aversion to cold, shivering, sneezing, cough, runny nose. And of course with the runny nose there'd be a white watery mucus. There's no fever, or there may be a slight fever. We have severe occipital stiffness and ache. No sweating, no thirst. The body of the tongue is unchanged and it may have a thin white coating, and the pulse again is floating. Again, to mark the invasion of cold, the pulse may also be tight. Looking at combination of wind and heat, we see that the main clinical manifestations are aversion to cold, shivering, sneezing, cough, a runny nose with yellow mucus. There's no fever, or there may be a slight fever. Severe occipital stiffness and an ache. Slight sweating, and there will be thirst, an itchy throat, maybe some swollen tonsils, and sore throat, which is a classic symptom of invasion of wind heat. The tongue would have a red on the tip and on the sides, and also there'd be a thin white coat, maybe yellow, but it's probably going to be thin. And the pulse is floating, and there's also a rapid quality as well to the pulse. When we combine wind and damp, the main clinical manifestations are itchy skin, skin rash, urticaria or hives, fever, aversion to cold, sweating. There'd be a feeling of heaviness in the body, swollen joints. There's also occipital stiffness and ache. And the tongue, the body may be unchanged, but there will probably be a thicker coat and maybe slightly greasy coat. And the pulse is floating with the damp quality of slipperiness. Another combination with wind is wind-water, and the main clinical manifestations here are edema, especially on the face. There's a swollen face and swollen eyes. There may be cough with a profuse white and watery mucus, aversion to cold, occipital stiffness and ache, and some sweating, but no thirst. And the tongue, the body is unchanged. There probably is a wet coat, and the pulse is floating. Let's look at the other pathogenic factor, cold. And this relates to imbalances manifested as conditions that diminish the body's immune system, such as colds, cough, upper respiratory, allergies, as well as poor circulation, anemia, and a weak digestion. Internal cold can be full or empty, excess or deficient. Full cold originates from climatic cold, which either invades the channels causing painful obstruction syndrome or invades certain organs directly. Internal cold, when we look at them combined, we see a full cold has an acute onset, the pain is severe, the tongue has a thick white coating, and the pulse is full, tight and slow. In empty cold, it's usually gradual onset. There's a dull pain or ache. The tongue has a thin white coating, usually wet, and the pulse is empty, deep and slow. The nature of internal cold is very similar to climatic cold. The person reports feeling cold regardless of high temperature. Activity is frozen, everything is slowing down. Cold is a kind of stasis, and it can cause other stagnation, particularly blood. There's usually sensations of contraction. The pain is stabbing in nature. Cold can also combine with wind and damp. When we look at the main clinical manifestations of cold, we see chilliness, there's sensation of cold, and of course there's a desire for warmth as well. Person desires warm foods or warm drinks. The hands are cold, feet are cold, and other parts of the body, and there's the clear and copious excretions, runny nose, and profuse and long urination. And it must be remembered as well that cold can have a high temperature. That concludes this particular lecture. I hope you found it useful, and please bear in mind that you need to be in class to gain extra notes. This is only a very short video for a longer lecture in class. Okay, until the next time, sláinte.